I want a beauty that will give me that glow. The kind of body that'll make them say, whoa. Get it right with the knife who slays. Beauty and the blade. Yeah. Get it right with the knife who slays. Beauty and the blade. Get it right with the knife who slays. Face and body. And the blade.
Welcome back to Beauty and the Blade. We are super happy to have you back. I am Dr. Edward Park and my lovely, gorgeous wife, Ashlee Park. And today we're going to be talking about plastic surgery myths.
Ooh, that's going to be a fun one. Well, let's start with the smash or pass.
All right.
Okay. So I have been hearing lately, and I don't know who has done it, but rib removal.
Wow, that's pretty aggressive. So in training, we have done rib removals for various reasons, but aesthetically, I have heard perhaps Janet Jackson may have had a rib removal to look thinner in the waistline. Pretty aggressive and extreme.
But is that really going to bring in the waistline, like when you remove the ribs?
Well, when they're looking at the 12th, 11th, and 12th ribs, they're called floating ribs. So theoretically, if you remove those, then you can potentially get a little thinner there.
Okay.
But I have never performed those. However, there is rib that we do use in order to reconstruct the bridge of the nose.
Yeah.
So that's cool. I think that's legit.
Yeah, but that's not actually cutting out and removing
Correct.
the rib. It's just shaving a little part of the bone.
Correct.
And
Right.
I would say pass.
Definitely a pass for me.
Yeah.
I'm not doing it.
Nice waist is good and all, but are you going to go that far I can't
No.
even imagine how painful, right?
Anytime you work
and
on
what
bone.
would that recovery be like?
Very painful.
That's, yeah.
As well as the fact of high risk, you have the lungs right below your ribs.
Right.
And so there's potential for what we call
Right.
pneumothorax.
You have no protection anymore.
You can potentially injure the lungs. So let's be real wary of that. Definitely a big pass for me.
I'd say 1, 2, 3.
Pass.
Okay, so top 5 plastic surgery myths. Are you ready?
I am ready.
Okay, I'm going to read them off for you. Number 5, plastic surgery is all about beauty and vanity.
So beauty and vanity, I'll let you take this one first. I will tell you this, that plastic surgery, when we train, and a lot of people don't know this, is we train vastly in reconstruction.
Right.
So that's why it's called plastic and reconstructive surgery. So what we learn first in our training and education is reconstructing to the norm. We're talking about burn surgery, cleft lips and palates, hand surgery, facial fractures and reconstructions to get things back to normal. These are injuries that happen. Cancer reconstruction is huge. And we learn first to reconstruct to the norm. Then aesthetic surgery, of course, is perhaps enhancing the norm.
So is plastic surgery all about beauty and vanity? I think that when one that doesn't know in depth of how you just explained, they would think, yeah, it is about beauty, right? But I don't think it's definitely not all about beauty and vanity.
I think, again, in our field, it's probably 80% reconstruction. But what people view and know is cosmetic or the aesthetic surgery component, which is about making people feel or enhancing beauty. Now, what are your thoughts on vanity?
I just feel like, plastic surgery, when it comes to somebody talks plastic surgery, I'm like, oh, what did you get done? It's like some facial surgery, or they had their breasts done, their mommy makeover. I feel like it's about beauty, I feel like.
It's about beauty, but I think we've talked about this before. If it's going too far, then I think you can be going into the level of vanity.
Right.
But even in aesthetic surgery, I wouldn't call it vanity per se. Let's talk about the tummy tuck. People, if they think that's vain, that is absolutely almost reconstructive in my mind.
Yeah.
Because at 9 months of separation of the muscles we talk about, there's no diet and exercise that can bring those muscles back. So when I'm doing a tummy tuck, I consider it reconstructing the muscles back
Yeah.
for core strength. That's not
Right,
vanity.
yeah, and I feel like I mean, everybody has their own opinion, but I feel, as a mother of four, your body changes so much.
Tremendously.
And it's really hard, especially postpartum. Like, what happened? Like,
What happened?
yeah, like first of all, it's so crazy that your body can stretch, go back, and there's a lot of women that it really doesn't go back.
It doesn't.
But when I had my mommy makeover, I loved it because I did everything to try to work out my stomach. I'm like, okay, 100 crunches a night. Okay,
Right.
we're going to do some more. It's not getting
Yeah.
there. How come I still have this gap, And you just have this like lower gut that just does not go away. It's
I
so
had
tough.
that.
So, yeah, I don't think that it's vanity, but everybody has
Right.
their own opinion. But personal opinion, no.
I think specifically in that mommy makeover, I mean, come on, guys, you try housing a baby and stretching out your chest and breasts and tummy 9 months out. I mean, that is physiologic damage to the tissue. When the
Right.
breast engorges the milk, it's stretched out to the max. So again, I look at that more reconstructing it back to the norm for breast and tummy. Now, if we go to the face, I would call that more rejuvenation, refreshing, right?
Right. Yeah. I just, when you said, "Oh, men, if your body were to go," I
Pregnant.
think I tell my husband this almost every
I don't want to
day.
get
I'm like,
pregnant.
why do us women have to like go through all of this
Right.
stuff? I would love for you to just do it. I want to put
No, thank
something
you.
like electrical on your stomach and
They've done that, and men, they don't tolerate that pain.
Right.
No.
Okay, let's go to number 4. Plastic surgery patients are the rich and famous.
Think of the Kardashians on that.
Yeah, no, I would say
It's
that's
interesting.
a myth.
Yeah, definitely a myth. I would say maybe years and years ago, plastic surgery was not as popular, but I think with social media, TV outlets, it's almost become the norm. I would say,
Yeah.
even in the States, certainly in other countries like Korea, there are people that get nasal implants and eyelid surgery in Korean young teenagers. So it's becoming culturally more accepted. And gosh, my patients are definitely not rich and famous. I would say they're certainly
Right.
kind of normal.
I have a question. In what country did plastic surgery first start?
Gosh, now you're asking me history.
Yeah, I would really like to know that.
Well, I think all over the world, it's been, again, reconstruction has been kind of the forefront. So when we
Right,
look at
right.
world wars, World War One, World War Two, you can think about that's when we learned about reconstructing big wounds and things like that.
Right.
But I can tell you there was gosh, I think it was in like the 1700s, there was a surgeon or someone named Tagliacozzi. I know, I can't believe I pulled that out. Tagliacozzi, who did a nasal flap reconstruction from arm skin.
Wow.
So dates back way, way long ago. There are written scriptures even in Egyptian
Okay.
for plastic surgery. So we've always been
That's
around.
fun. We've always been around. Okay, so number 3, only women get plastic surgery. That's a myth. Ladies and gents, Dr. Park does plastic surgery for everybody. And
So what
Ladies
percent would
and
you say are men in our practice?
in our practice, well, I feel in the last 10 years, it's really grown with men. And also husbands and wives coming in together.
That's cute. I love that.
Yeah. So years ago, I felt like a lot of women were hiding it from their husbands
Right.
because their husbands were like, I'm talking now about injectables because I know more on that side. I feel like they're like, just do a little bit. My husband doesn't know. He's going to be upset, But now I don't know. I want to say that there's like 60%?
For men?
Well, I want to say 50-50.
No, I would say honestly
well,
maybe
plastic surgery side.
Yeah, if you're talking about fillers,
Yeah,
I do agree with that.
I would say 50-50.
Yeah, maybe men are coming up there, but
Yeah.
in my practice, I'd say maybe 10 to 20%, and certainly rising. I would say men, the most common. I would say liposuction probably up there as one of the top three. There's actually gynecomastia, which is a
Right.
very popular
And what is
procedure.
that?
So gynecomastia is when a male, either young or old, will have glandular tissue in the breast
Right.
that forms kind of over more than what they wish. So there are various ways to treat it with liposuction. Sometimes the breast tissue behind the areola gets very firm. That's gynecomastia. So I have to excise that kind of glandular breast tissue. We do a strict hormonal check. Sometimes medications can cause it, steroids for sure, testosterone, things of that nature. So once they're cleared of that, then yeah, lots of removal of gynecomastia in males.
Okay.
So that's the second one. And then going into the face, eyelids and facelifts, you talked about the fillers for sure.
Yeah. I feel like it's 50-50. We're seeing equal men and women.
Equality.
Because now Botox can be Brotox.
That
So
is a good one.
let's go to number 2.
Well, before we do that, let's break this up and talk about your favorite non-surgical procedure.
My favorite non-surgical procedure
Yeah.
for myself, I would say, okay, I'm a fan of hydrofacials.
That's a good one. Talk about that.
So basically how I describe that is it's like a little wet vacuum going over your skin.
Yeah.
And my favorite part, don't think I'm gross, but at the very end, we have this tube that you can see everything.
Who does it?
We have Lisa, our esthetician.
Lisa,
that does
our
it.
lovely
Yeah.
esthetician. You've got to meet her.
Yes, and so you can see all these particles, like all the dirt,
Yeah.
the blackheads, all of that. I don't know. I just love seeing that because I just feel so much more cleaner.
Yeah.
That like I don't have all that junk in my face.
Who can get hydrofacials?
Everybody.
Including kids?
Yes, we have teen hydrofacials.
We do.
Our daughter even goes in and gets hydrofacials. I mean, it's a good age to, when you start to see that your child is maybe a little emotional, their moods are going in waves, I'm like, okay, puberty is about to hit. So you want to prevent,
Skin.
I suffered from a lot of acne growing up. How about you?
I had that Rudolph the Red-Nosed Reindeer nose. Yes, acne is a horrible thing. Yes.
Yeah.
I went
Did you
through
get
that.
it all over your face or just on your?
Scattered, yeah.
Yeah.
But we didn't have hydrofacials back then.
Nobody
So-
even informed me on skincare. I think
Right.
I was washing with the Dial soap.
Right.
You
So I
know?
think hydrofacials, definitely give us a ring on that at 1-888-900-9065, 1-888-900-9065, and meet our entire team. Lisa is phenomenal. She's the sweetest person that you'll ever meet that treats you. She's the master of hydrofacials. I don't think I've had one in years, but
Have you ever had one?
I think I had a little tester. I just haven't had
You
time
need
to
to
get
do
there.
it.
I do.
Once you do it and you have the full treatment, you'll be addicted.
Right.
You'll
And-
love it.
But it's super cool to see all 4 of our kids have had hydrofacials, and
Right.
Renee's 9, and it's super cute. She's laying in the spa chair and getting treatment on her face.
Right.
And I do believe it's super powerful and effective in getting the skin
Oh yeah.
cleansed.
Yeah. So,
So-
can I talk about my other
Yeah.
favorite one? So
You have more than one?
Yeah.
Okay.
And this is Exelis. I love
Okay.
this radio frequency. I mean, you can use it anywhere. And
What are some of the areas?
so I'm gonna go over them right now,
Knees?
head to toe.
Oh,
Okay,
wow.
ready?
I'm ready.
So you can do forehead,
Uh-huh.
upper eyebrow. You can do cheek lift. You can do
Neck.
You can do arms.
Armpits.
You can do armpits because we all know
Elbows.
all of a sudden we get this like I'm waving up here, but then my lower arm is waving too. So
arms
it's
as
great for
well.
that. It will tighten the skin.
Okay.
It helps if you're working out, it helps tighten the muscle as well. And then you can go onto the stomach, bra fats, thighs, inner, outer, knees.
How and to clarify, this is non-invasive,
Non-invasive.
and it is how long is a treatment? Like
Well, it depends on how many areas
one
you're
area,
doing.
yeah.
So if you're just doing one area, and it depends on how large the area is, right?
Okay.
So let's say if you were doing your eyebrows,
Okay.
30 minutes,
Okay.
if that. There's no numbing. You don't need any of that.
No
you don't
recovery?
need any pain management. No.
Yeah.
Yeah, no recovery at all.
Wow.
Yeah.
I think I need some Exos in my life.
Yeah, you should
All
try
right.
it.
If I could get a hydrofacial
You need to try
first.
everything.
It's funny. Okay, running joke. Literally, I have not done any. I don't think I've done any med spa procedure.
Right.
And it's
why?
not that I don't want to do it. It's I just don't
you
have
scared?
the time. I'm not scared. I mean, it's a hydrofacial. I'd love to get that water oily stuff out. But so my favorite non-surgical procedure is, in terms of performing, I haven't done anything myself,
Right.
but I do love our fractional CO2 laser. I think it's super powerful. Either myself or one of my nurses, RNs, for example, Janae, will do a beautiful CO2 laser. In the old days, the CO2 lasers would blast the skin and it'd be a
Right.
really bad burn. We now have the technology of fractionating that CO2 laser that breaks it up into tiny beams, so the recovery is much quicker.
And the recovery is how long?
So generally speaking, these are deeper procedures. I do take you into the OR to do this,
Right.
but we want this laser not like a med spa where it lasts only like a few months. This should last 3, 4, 5 years.
Okay.
So we're lasering the face. The face then does peel over about 5 to 7 days. And after that, you have this smooth, pink, toned, tight skin. It treats fine lines, pores, and just tightens that skin with a beautiful glow.
So when you speak of tightening, can somebody do this instead of moving to a neck lift or a facelift?
That's a good point. For anything that's dropping, if you see jowls and
Yeah.
neck skin, then we do need to do a lift. But when we're seeing fine lines anywhere around the face that are not Botox treatable,
Right.
then the fractional CO2 laser is awesome. I love it. Yeah, it's very powerful.
So you've not done any procedures, but I want to know
No.
what is your favorite surgery to perform?
Surgery. You probably know my famous contoured abdominoplasty
Yes.
procedure, which I'm kind of known for. So I use special techniques in the abdominoplasty, no pain, no drain, in order to make it. And my goal is to just snatch that waist. I
Right.
really, really want to get that waist silhouette hourglassed in, like Your Beautiful Body and so many others. But I just think that is just so rewarding. And the other really important part of that is your core strength improving.
Right.
Did your core strength improve?
Oh my gosh, I can plank so much longer now.
Really?
Yeah.
Yeah.
That was a huge change. I mean, I'm not talking about like 10 minutes or anything, but
Yeah.
I went from 5 seconds to now a minute. No, I'm just kidding. No, I feel like I
7
was like
seconds.
at about like 2 minutes before. And
Right.
of course, like I could have planked earlier and worked out earlier than what I did, but I was a little nervous to
Right.
start working out because I just thought like, oh my gosh, am I gonna like bust a suture or
Yeah, it
something
feels
like
tight,
yeah, you
weak.
just have that different feeling.
Yeah. And I will say that after tummy tucks, I let my patients start planking at 6 weeks. So immediately, just after a few weeks, you're building that core. And I've done studies in my patients where they're planking more than twice as long
Right.
than before surgery.
Yeah.
I mean, that's really important for physical benefit, lower back support from the core strength and all
Right.
that.
And even doing sit-ups, like I feel like
Mhm.
my abdomen is a lot stronger than what
Yeah.
it used to be.
Yeah.
Okay,
Love it.
so let's go to number 2.
Number 2.
Are you ready for another question?
Yes, ma'am.
Okay. Plastic surgery leaves no scars and lasts forever.
Well, we know nothing lasts forever,
Right.
but let's talk about scarring. I think, again, that's kind of plastic surgery our specialty, right?
Right.
My goal is to hide or disguise a scar or make it nearly as invisible as possible. So if we talk about different areas, facelifts, I can do it right around all the crevices of the ear.
Okay.
And as you know, we see hairdressers looking and nearly invisible, which is so awesome. Part of the reason is facelifts and face has a lot of good blood supply, so it heals beautifully in that area. If we've seen like elbow scars, not so good, right?
Right.
So um, scars are always going to leave a little bit of a scar, but my goal is to hide him. Let's say in the breast augmentation, hide him in the crease or at the mark of the areola. And again, we're trying to disguise our scars.
So what if you have a patient that they've keloided in the past?
Oh, that's a
Is
tough
that
one.
are they gonna keloid in every part of their body?
Yeah,
Or is it more in a certain area?
that's a good point. People heal differently, and it depends on skin type. We have a Fitzpatrick scale, which means the darker the skin is, the higher chance of keloiding. So in darker skinned patients, they do have a propensity to keloid. And I'll let them know. I'll usually ask them, I'll say, hey, have you keloided anywhere else? And if they have, then chances of, if I do a tummy tuck, they'll have keloiding. So there are treatments we can do. Keloids can be treated with steroid injections,
Okay.
silicone tapes, scar creams. And if it gets really, really aggressive, we've done keloid excision and sometimes even
Right.
radiation treatment, which is pretty
Oh.
extreme.
Okay.
Yeah, so there are treatments.
Yeah. But is there a certain part of the body that it's more likely to keloid, or if you keloid, you keloid everywhere?
More areas of worse scarring and keloiding in body parts that ranges of motion, for example,
okay.
knees, shoulders, tummy, because we're moving in those areas.
Right.
And so that's when you're going to see more keloiding.
Oh, okay.
Yeah.
So here's another one. Plastic
Okay.
surgery is the same as cosmetic surgery. Do you get irritated when somebody says, Dr. Park is a cosmetic surgeon?
That's kind of a hidden secret pet peeve of a lot of plastic surgeons because we're technically board certified by the American Board of Plastic Surgery. And a lot of the common public doesn't know this, that cosmetic surgery is not a true board. They kind of created this board and it's not acknowledged by the American Board of Subspecialties.
Okay.
So we do have this little kind of silent war game with the cosmetic surgeons, but we always feel that we've had such extensive training in all the reconstruction that, you know, we always say that what is your worst complication? You better be able to treat that.
Right.
And a lot of cosmetic surgeons have been trained maybe 1 year in something and say they're a cosmetic surgeon. So not to say that that's any worse, but the training backgrounds are very, very different.
Right. And I've heard there's been, doctors that are a GI doctor and then they are doing
Right.
cosmetic. What is
Yeah.
that education? Like, what do they have to
Exactly.
do to get to that point?
Sometimes they just take a weekend course or
Oh,
a few months
really?
or a year. Yeah. In the old days, we had, even my previous partner, ENT, doing body stuff and things were just not really overseen. So really do the research on your plastic surgeon
Right.
and see what their training background is. Because you could have an OB-GYN person doing a tummy tuck.
I just feel like board certified in plastic surgery is the biggest and most important thing.
I agree.
Yeah.
I'm a little biased, but yes.
So you mentioned pet peeve. I want to know, what is your personal pet peeve? Kind of off subject, but I want to know that.
Of anything?
Think of anything in the world. Like somebody does something and you're like, oh, that drives me crazy.
Okay. You know that I love racing.
Uh-huh.
Okay. And I love to go fast on the road. So I like to be number one at the stoplight, green light, etc. So one of my pet peeves is, why is the slow person driving in the fast lane of the freeway that just, like you said, that just drives me nuts. So if you're slow, please drive in the right lane because, yeah, that's what the right lane's for. But
Oh
how about
my
you?
goodness.
How about you? What's a pet peeve?
So my pet peeve is, it's going to, I don't know, be a little weird, but when people are eating and they're like slurping their food or like chewing with their mouth open. It just like sends chills down my spine.
Yeah. You know what's funny? I'll tell you this because you married an Asian. In Chinese and Asian culture,
I
sometimes
did?
I hope you know that. I am. And our kids are half.
Yeah.
So, is they do slurp. That's just in the culture.
But why? Why do they have to
I
slurp?
think it's because it's a sign of enjoying the food. Loud noise. I don't know. I don't agree with it.
So next time I go to your mom's house,
slurp
I'm just
loud
on everything I eat and
just
drink.
slurp
I'm
it
like,
up. She'll love it. She'll be like, oh, she really enjoys it. So, yeah, we love to. Time is running out, and we just had a lot of fun. We're gonna wrap it up here, and we absolutely enjoyed just having this conversation with y'all. If you have any questions, look us up at faceandbody.com, faceletterandbody.com, and IG. Follow us at faceandbodyplasticsurgery. Not .com there, and call us at 1-888-900-9065, 1-888-900-9065.
Thank you so much for joining us on Go Country 105. Beauty in the Blade, where beauty begins.
Oh, I want a beauty that will give me that glow. The kind of body that'll make them say, whoa. Get it right with the knife who slays. Beauty and the blade. Yeah, get it right with the knife who slays. Beauty and the blade. Get it right with the knife who slays. Face and body in the blade.